I
Uh,
hope that
okay.
everyone can hear my great voice today.
Mm,
Hopefully
okay.
everyone can. So it's been a while. We are not having any live sessions for quite some
Mm-mm.
time. And today we
Mm-mm.
with another interesting topic today, and I hope that all of you will get some benefits from our life today, which is related to trauma. And
Yeah.
I'm a bit sorry for voice today. I hope that I can do very well. I can share with you as much as possible, and I hope that you guys can get some benefits from our topic. So for today's topic about trauma, right? So what we are going to cover is understanding the trauma itself, what is trauma, and then we go through the symptoms of trauma related disorders, for example, PTSD, post-traumatic stress disorder, etc. So we are going through the symptoms, and then we gonna discuss what we can do or how to process the trauma. Have any I know of our session today. So
Mm.
before we start talking about trauma, do you have anything to say, Ira?
Oh,
Yeah.
okay. So, hi guys. So, good to be back with our audience lah kan to have a live hari ni. So hari ni baru first time live after it has been so long. And masuk-masuk je Syahri dah tak ada suara. So
Yeah.
I hope that you guys can sustain with us lah sampai pukul 1.
Yeah.
So macam Syahri cakap hari ni kita nak cakap pasal trauma kan?
Uh,
Kenapa Syahri kita nak cakap pasal trauma ni Syahri? Apa yang bestnya tajuk trauma ni?
trauma, trauma. Kenapa dia best? Kerana dia memberi kesan yang sangat signifikan dalam kehidupan seseorang.
Ya,
So that's why
betul.
important to understand whether mungkin individu tu sometimes people might feel confused about themselves, and sometimes they don't really understand why they behave like certain things, why their emotion, why he like this, why he like that,
Hmm,
so lots of internal dialogues happen to understand
ya,
about that.
betul.
It could be because of the trauma that you experienced in the past. So
Ya, betul.
uh,
And bila kita, apa tu Syahri? Ini bukan suara rock dah Syahri. I tak dengar apa you cakap. Ah,
with you as to know whether
ah,
you do trauma or not. So that kalau you dah tahu sama, for example, you know that you have trauma, so you can do something about it lah. So that is important
mm.
for you to understanding trauma also part of the important things, and not just that. If it's not related to you, maybe people around you, you see the symptoms or you see a sense of trauma for people
Mm.
around you also can do something lah for them.
Betul. And kenapa juga topik trauma ni penting sebab we always thought that when it comes to trauma dia macam trauma yang macam a big event kan, contohnya
Yeah.
macam trauma disebabkan kematian ke, trauma disebabkan kehilangan seseorang ke, trauma disebabkan accident ke, contohnya orang kata one off event lah kan. Tapi actually trauma ni dia bukannya it's about a big event tau, yang macam one off event macam tu sahaja atau bila kehilangan seseorang sahaja. Trauma dia merangkumi macam-macam benda lagi. As simple as bila you kena reject ke, bila you kena humiliated ke, bila you kena abandon ke, those can also cause trauma to you.
Yes.
Yeah, sebab trauma ni bila you rasa macam benda tu dah tak safe untuk you, bila you dah rasa danger untuk you, that is trauma. Itulah yang
Yeah.
dimaksudkan dengan trauma.
Yes. So what is
Kan?
so let's start it.
Macam yes, what is trauma?
So what trauma is right? So
Yes.
tadi kalau istilah dia we call it as a
Mm-mm.
psychology or emotional response to an event. So that is the definitions lah. That will cause a significant impact to a person. Maksudnya reaksi or respons psikologi or emosi terhadap sesuatu event that happened in the past or currently, and that can create significant impact in your life. That is trauma. So that adanya event, bila you melalui satu event, bila you dah experience one event, is psychologically or emotionally response to these events and it significantly impact. Yang tu trauma. So maksudnya sebagai contoh, kalau you hari ni you accident. You accident sebagai contoh. Accident, and then bila accident berlaku, kesannya terhadap you punya fizikal, kesannya tak, you notice a significant impact towards your psychology, and then emosi you terkesan. Yang ni lah kita panggil trauma. Sebab tu trauma can become physical, it also can become psychological and emotional. Sebab tu kalau you tengok dia ada kan emergency dan trauma. Trauma kat situ bermaksud it can be physical trauma, it can be a psychological trauma and emotional trauma.
Betul.
So basically trauma itself is a response of psychology and our emotions towards certain events.
Betul. Bila you cakap macam ni kan Syahri, it reminds me of a story lah. A story of a traumatic events. But it managed to overcome lah on this part. So this story, the person involved in accident because of microslip. Okay, so because of that event, dia esoknya bila dia perlu pergi kerja kan, dia tak berani dah nak bawa kereta. Sedangkan dia accident microslip tu, the car tak ada damage yang teruk pun, dia just scratch sahaja. Tapi you see how the event, walaupun the car tu tak ada damage yang teruk, tapi the damage happens to you. Correct. So maksudnya your emotions and your mentally was affected by it lah. Sebabnya you tengok dia dah tak berani nak bawa kereta. Dia take time berhari-hari untuk dia bawa kereta semula. Even pegang pintu kereta pun dia tak berani. Sebab the moment pegang pintu kereta, dia terus teringat balik dia punya accident tu. Bila pegang pintu kereta je dia rasa takut. So macam Syahri cakap tadi lah, the physiological effect pun akan terganggu when kita akan rasa physical symptom. Contohnya bila macam orang tu kan, dia pegang pintu kereta je dia rasa anxious. Dan bila dia rasa anxious, that's where palpitations come in. Dia akan shaking, dia macam jadi freeze dekat situ. So these are the physical symptom that comes in lah because of the emotional reactions toward the traumatic event. Kan?
So basically, kalau ada apa nak senangnya, biasanya trauma ni dia ada banyak jenis. Trauma ni it can be categorized into 3 types of trauma, which is acute trauma or chronic trauma or complex trauma. So that for acute trauma ni adalah satu trauma yang you lalui atau satu psychology or emotional response to an event that happens within a month or a short period of time. Biasanya within a month lah. So that bila kalau dalam short period of time, kita panggil dia acute trauma. Tapi kalau it continues, tapi this acute trauma only happens for that particular event. Maksudnya berlakunya satu event, satu experience, and then after it significantly impact you after that experience, and then bila significantly impact you dalam tempoh masa sebulan macam tu, ni kita panggil dia acute trauma. And then kalau dia berpanjangan, si syahud lagi berlaku benda ni, and then it repeated continuously, for that particular event, it reminds you continuously. Sekarang yang ni kita panggil dia sebagai chronic trauma. Chronic trauma adalah satu trauma yang berterusan, ongoing sampailah you sekarang. Yang ni chronic trauma. And then the last one kita panggil di complex trauma. Complex trauma adalah dia melibatkan multiple events and is ongoing. Multiple event ni adalah banyak event yang berlaku dekat you dan those events significantly impact you and that is ongoing until now. That is complex trauma.
And Syahari, ni ada pertanyaan ni. Is it similar with panic attack as the symptom quite similar but I may be wrong? Okay, so bila you experience trauma, panic attack can be one of the symptom yang menunjukkan your emotional reactions, your body reactions toward a traumatic events.
Yes,
so macam I cakap tadi lah, when you experience trauma, you will have a body reactions kan toward that traumatic experience. So panic attack could be one of the body reactions. Because when you are having a panic attack, you akan rasa difficulty to breathe. Kan? Difficulty to breathe, lepas tu mungkin rasa macam nak pengsan, mungkin rasa macam dah sampai masa dah ni untuk aku go ni. Dia macam tu, ataupun rasa macam shaking. So this could be, maksudnya panic attack could be one of the body reactions lah when you feel anxious because of the traumatic events. So we hope we answer your question.
Banyak contoh-contoh events yang kita boleh tengok and it's not necessarily tense event lah. Trauma can be benda-benda from us kita tengok simple. Contohnya macam my pet passed away sebagai contoh and then dimakan oleh another pet. Macam tu. My pet ni my pet macam died, mati. Kena makan dengan
apa pet? PET, pet.
Yeah,
I dengar pen Syahri apa? Sorry. Okay. Okay.
Macam ni. Contohnya macam you punya binatang pelihara tu kena makan dengan another pelihara. So it significantly impact your life. Nampak tak? Yang ni walaupun from other perspective or it just an animal or something like that. So it can be trauma to another person. So regardless of it is a small event or big events, it can be a traumatized experience.
Yes. Betul. Betul.
Sekali impact you lah.
Ya, betul. So macam I cakap tadi, as long as you rasa uncomfortable with it, seperti macam you rasa being humiliated ke, ataupun you rasa being abandoned ke, you being rejected, you being rasa unsupported, unsafe. So it can be considered trauma as well. So maksudnya trauma ni bukan sahaja datang daripada big event.
Ya, betul.
Event yang kecil-kecil pun boleh cause trauma to you. That's why sebab itulah kita nak emphasize on this topic. Sebab trauma ni bukan trauma ni adalah situasi mental health issues as well. So kita dia punya mental jugalah. So dan bila kita experience dengan orang yang ada trauma ni, kita tak boleh avoid lah untuk bercakap dengan dia, alah benda kecil je pun kenapa nak sampai trauma-trauma kan? Cause kita tak pernah tahu macam mana setiap orang kita punya body reactions toward a certain things. So bila deal with the trauma ni, regardless of what kind of traumatic events yang people cerita dekat kita, try to show at least a little bit of empathy.
Yeah.
You never know. Yes. Yeah.
Because trauma can be happen to anybody and also from us, from our perspective, mungkin tak nampak sebagai trauma, tapi for those who experience that event can be a traumatized experience.
Betul. That's true.
Okay, can childhood be classified as ongoing trauma? And betul. This is a common things lah sebenarnya bila berlakunya di masa kecil Yes, it can be ongoing trauma. Yeah, it can be either chronic trauma or complex trauma. Yang ni kita kena
Ya.
tengok event-event yang berlaku masa kecil tersebut. Sekiranya there are multiple events that traumatize, become a traumatizing experience for that particular person. So it could be a complex trauma. Tapi kalau it just one event, it can be a chronic trauma. It depends lah based on the professional evaluations lah. So that
Betul.
so childhood trauma, yes, correct, is an ongoing
Mm, mm.
trauma.
Mm, mm,
Macam
mm,
tu.
mm, mm.
I
Bila
never
cakap pasal
I never
apa tu Syahri?
I never thought trauma at a short period of time. Yes, correct. That's
Ah,
why for it
okay.
to be in this
Ah,
life, know more
I
about
tak tahu
trauma.
I tak tahu Mik UO ni dah masuk tadi belum masa I cerita pasal story tadi tu. So
Yeah.
yang story yang I cerita tadi tu it just happened orang tu ada masalah untuk naik kereta untuk drive for the few days sahaja. Tapi it's still
Yeah.
considered as trauma sebab
Yeah.
dia meninggalkan significant impact pada dia. Dia dah ada avoidance behavior, dia dah tak nak naik kereta, dia tak boleh nak drive padahal dia nak kena pergi kerja ni. Tapi disebabkan tu dia terpaksa work from home.
Yes.
Baru 3 hari je tapi it's still considered as trauma lah sebab dia bagi significant impact. Macam tu.
Wih, banyak
Okay.
soalan. So, what are some
Itulah tu.
question of treating? Okay, for this question, right, we're gonna talk about at the end of live session. So stay tuned. So because we are going a few times, a few things that can be done if you are not if you are a normal person, so that you can use this technique in helping those who have trauma and for yourself as well in treating your in recovery in processing your own trauma. But yeah, we can talk at the end of our
and how long trauma can be healed? Wow. That's a direct question. Yeah, frankly speaking, there is no specific time to answer how long trauma can be healed. It depends on the individual itself lah. So macam mana so frankly speaking, in order to heal with trauma, it's good if you could get a professional advice on this, a professional guidance on this, because trauma, walaupun yes, you are the one who experienced that, tapi because you are attached to that event. So because you are attached to that event, you can't see things that are outside of the box already. So that's why you need other people's guidance yang lebih professional to guide you lah to heal your trauma. But to talk about the duration, there is no specific time. It depends on the individual itself. And it can take a week, it can take a years, it can take a decade pun mungkin. Kemungkinan besar pun macam tu juga. It depends on the individual lah.
And it depends on the severity of your trauma as
Betul.
well. Acute trauma, maybe period of time can be lesser as compared to the complex trauma, because the severe the trauma, the more the longer the time for it's being processed lah. So that severity of the trauma itself.
Yes, betul. And apa? Kejap Syahri sebelum I lupa apa nak cakap. And bila cakap pasal trauma ni, it's not about kalau you dah heal daripada trauma, bukannya bermaksud yang macam okay, the trauma dah tak ada dalam diri aku. It's not like that. Tapi bermaksud you dah boleh adapt dengan situations yang bagi you trauma. Maksudnya bukan trauma tu hilang, tapi because you dah adapt dengan trauma tu. So that's what it means by the trauma healing lah.
Correct.
Tu.
One of the example lah, I would love to share with you about the trauma case that a very difficult case for I wanted to share with you. Ada suami yang mengalami trauma masa kecil di mana it just the words from the parents, you know, it just the words from a sentence from the parents.
Word apa Syahri?
Satu ayat daripada ibu bapa dia masa dia kecil meninggalkan kesan sekarang sehingga dia tak boleh functioning well. Apa words dia? Words yang apa ayat daripada parent dia mengatakan bahawa yang you know I should abort you when I in my pregnancy.
That's
Mak
harsh.
mak dia bagi tahu, you know, I sebenarnya I nak gugurkan you je ni masa I pregnancy. And this sentence remains and become a belief in her, making her not fully functioning person. So,
Actually,
whenever dia impact a lot of things. Dia impact dia a purpose of life. For example, that dia tak nak kahwin, dia tak nak ada anak anymore. Dia bila dia tengok ibu bapa orang lain, he or she's being triggered by this statement, and then dia tak boleh, bila dia melibatkan family je, dia terus being triggered, panic attack comes, and the anxiety comes, and then all the anxiety symptoms appear, and then dia bila contoh dia nak pergi kerja, and then before dia pergi kerja, this thing happen, dia tengok a family connection, and then he started she or he started to become triggered, and then he gonna focus on his works. All these symptoms appeared bila being triggered by this, and it started from childhood by a single sentence. So what I want to share is actually sentence also can be a traumatized experience to hear for a person lah. So that is trauma. And to
macam you
recover,
sentence kan? Apa dia cari?
it's not easy to process this thing, you know. It just
Yes.
for people, they can say that, oh, you can just move forward from this nothing.
Move on
This,
kan?
maybe, just move on. Maybe the parents
Yeah.
is to you because they want to see an improvement to you or something. So for some people they can say this, but for someone who experienced this event, it's very difficult for them to process this thing, and it's affect things in their life.
And not only that, macam you sentence, kalau macam okay, I would like to share this thing juga. Dia bukan datang daripada parents, tapi datang daripada cikgu dekat sekolah. So this person dah grow up tau, dah besar, dah bekerja. Tapi masa sekolah, dia selalu dengar cikgu menjerit. Dia selalu dengar cikgu menjerit. Tapi menjerit tu bukan direct pada dia. Direct pada menjerit tu pada kawan-kawan dalam kelas lah. Tapi because she can't take macam mana cikgu tu menjerit, shouting at the student, so sampailah ke besar bila dia bekerja, dia dengar bos dekat dalam office sendiri. Maksudnya dia dengan bos office tempat berbeza lah kan. Tapi dia dengar bos dia marah, menjerit dekat telefon semua, marah pekerja lain. Dia jadi macam terus jadi macam anxious, macam serba tak kena. Sebab dia tak boleh dengar kind of menjerit-jerit. Macam tu. Tapi dia mendengar bunyi yang kuat, contohnya macam bunyi kilat ke guruh ke apa, benda tu tak trigger dia. Tapi bila the moment dia dengar orang menjerit, dia terus rasa macam anxious, berdebar tak tentu arah. Macam tu. So nak cakap dekat sini, macam kita cakap tadi lah, even a simple event also can trigger a person to have this trauma lah.
So I think it's related question lah, Ira, how to control trauma. Walaupun saya kena marah. Maksudnya what I understand from this, actually satu situasi yang ada orang kena marah, dia yang being triggered.
Yes. Maksudnya dia dia jadi bergegar walaupun bukan saya yang kena marah. Maksudnya benda tu tak direct kena dekat you, tapi you can feel the impact dekat diri you. So how to control the trauma, we will talk about that later lah. Laju sangat tu.
That's actually a sign that you might have trauma in the past lah. Sebenarnya kalau direct affect you, that's a sign actually untuk you ada the trauma.
Ya,
Uh-uh.
Tapi frankly speaking lah, talking about trauma ni kan Syahri kan, macam kita cakap tadi, trauma ni bukannya it's about big event, sometimes small event pun boleh trigger trauma. And frankly speaking, sepanjang career saya, semua yang saya ni memang ada trauma daripada kecil lagi. Tapi
Yeah. Mm.
bukan a big event. Tapi dari setrauma, sebab itulah dia menjadikan siapa kita sekarang.
Correct.
Ah, and we
Dan
don't
kesan dia,
even know. Apa tu Syarif?
kesan dia sangat banyak. Bila ada trauma, you know, the way how the person see this world is pretty different than normal
Yeah.
people. Dan mungkin life expectation is totally different. Those who have trauma more higher expectation in life than compared to those who have no experience trauma. And those who have trauma might have the pattern of thought. They can be a very problem solving punya pattern di mana they are trying to survive from day to day due to experience itself. So that
Betul.
perceptions to this world, it can be very different lah with the normal people.
So talking about the reaction ni kan Syahri kan, biasa kita dengar pasal fight and flight response kan. Fight ni macam kita being defensive ke, kita being protective ke. Flight ni bila kita running away lah daripada problem tu. Ataupun kita try to solve the problem. Macam Syahri cakap problem solving kan tadi, ada reactions yang kita boleh nampak kebiasaannya macam freeze. Tiba-tiba dah nampak macam orang tu macam dah tak boleh nak bergerak ataupun nak buat keputusan pun dah tak boleh. Just imagine macam iceberg lah, macam air batu kan. Dia freeze macam tu, dah tak mampu dah nak fikir baik buruk benda tu, tak boleh dah. So itu freeze. Ada lagi dua yang saya would like to share jugalah, sebab biasa kita dengar fight and flight kan. So ada yang biasa je kita dengar macam contoh, macam you tend to become a people pleaser. You jadi mengampu orang. Sebab of the trauma that you have. Contohnya contohlah daripada kecil you tak pernah dapat a father's figure, for example, or a male figure kan. Dan sebagai seorang anak, it's understandable kita nak kedua-dua ada untuk guide kita sampailah kita membesar kan. Tapi sebab tak dapat, so bila kita dah membesar dan kita dah bergaul dengan orang, kita build a relationship dengan orang, and kita rasa macam orang ni boleh bagi aku rasa macam kasih sayang seorang ayah atau kasih sayang seorang lelaki yang aku tak pernah dapat dulu. So that's why kita pleaser. So orang tu sakitkan kita pun tak apalah, asalkan kita boleh orang tu boleh stay dengan kita, orang tu boleh bagi emotional support dekat kita macam mana kita nak ayah kita bagi dulu. So nampak the trauma also can make us become a people pleaser and make us rely our happiness depending on other people. And satu lagi adalah bila kita dah macam, how to say this, macam dissociate tau. Macam kita dah tak boleh kenal reality world dengan a traumatic world.
Betul.
So nanti we will talk about this lah. I mean, one of the technique about how to differentiate between you are not in your traumatic event anymore. You are in a present world. So these are some of the reactions that kita boleh nampak from someone who deal with the traumatic events lah. Okay?
We can look up into the symptoms of trauma, Ira.
Symptoms of trauma, okay. So maybe I will start with apa tu?
More details of symptoms of the trauma itself, so that people can about it.
No, okay. So let's start with the physical reaction dulu lah. Okay. So when we talk about physical reaction, macam ada persoalan sebelum ni pasal panic attack kan. Okay. So macam panic attack could be one of the symptom when you have difficulty to breathe, when you start shaking, atau you rasa tangan sejuk, atau you rasa macam hand sweating ke, rasa sweating lah kan. Lepas tu ataupun you rasa macam dah rasa start pening kepala. Those are physical symptom yang buat you rasa macam tak selesa.
Yeah. Mm.
Okay, it's not because of the migraine ke apa ke. Okay, you
Nah.
notice that you are having a bila you berhadapan dengan situasi yang mengingatkan you pada trauma. Lepas tu you
Ah,
notice bila you are in that position, you are in that situation, you terus rasa macam shaking. Lepas tu rasa macam
yeah.
tak senang duduk, rasa macam susah sangat nak bernafas.
Yeah.
Rasa macam tak selesa lah kan, rasa macam tak selamat aku berada dekat tempat ni. So
Mm.
those are one the physical symptoms yang boleh menunjukkan you tengah dalam keadaan trauma.
Yeah.
Okay?
Kan,
Hmm.
okay, baik contoh orang yang being abused or sexually abused during childhood by
Hmm.
multiple, for example, by a man or multiple men, many men. Masa dia kecil ataupun masa dia besar, dia pernah ada sexual abuse. Okay, bila dia bertemu je dengan lelaki, dia akan dapat all the symptoms. Or dia bila dia
Yes.
lelaki, dia akan dapat rasa macam berdebar-debar, rasa takut, rasa macam
Betul?
freak, rasa macam tak boleh nak buat apa. Yang ni
Yes.
itu reaction
Hmm.
trauma itself sebenarnya.
Yes. Betul? Dan bila you experience trauma juga, you ada memory yang sangat menyakitkan.
Hmm.
Maksudnya the memory tu keep datang pada you. So you got to say, maksudnya it involve a memory as well lah. So kita, kalau you join our lah daripada mula kan, we always emphasize how our thoughts make us feel something and make us behave in a certain way.
Yeah.
So memories is part of our memories pun dalam kita punya kepala kan, dalam kita punya mind kan. So bila kita teringat that kind of memories, then dia buat kita flashback ke, atau kita susah nak tidur malam ke. So those are the thing, memory itulah yang buatkan kita rasa anxious dan it affect kita punya behavior as well. Macam tu. Ada apa-apa lagi Syahri you nak tambah selain daripada physical symptoms? How about your thoughts, the thoughts pattern Syahri?
Yes. And one more thing related to sleep just now. Now sleep is a response to it. Kalau you nampak significantly impact or disturb sleep, maksudnya kalau you tidur you always experience nightmares. Yang ni juga symptoms yang kuat untuk trauma itself. So that bila experience banyaknya nightmares ataupun mimpi yang menakutkan comes to you bila you tidur, yang ni sebenarnya one of the big significant symptoms that you might have some trauma lah, or you might have a trauma that recently or in the past lah, or mungkin dia being of your past experience. For example, just now you pernah ada sexually abuse masa kecil, and then you didekati oleh a man, and then malam tu you adanya nightmares. Yang ni disebabkan oleh you being exposed to the exposure to your past experience or to your past trauma, malam tu you got the symptoms. Boleh jadi macam tu juga. So that that's juga one of the symptoms of the trauma lah.
Okay, alright. So that's the symptom of trauma lah. So we hope that kita dapatlah share sikit about the symptoms of trauma yang hope our audience juga dapat tahu tentang symptoms of trauma lah. Usually trauma ni it's related closely to feeling of anxious. So kalau kita tak dapat bantu, maksudnya kalau kita tak dapat proses trauma ni dengan baik, that's where another mental health issues akan datang.
Betul.
So itulah depression akan masuk, dekat situlah even can goes up until a psychosis punya symptom. Macam you experience hallucinations ke, atau maybe it's not psychosis tapi it's more like a imagination. Okay, even it reminds me of a story lah Syahri kan, about one of the cases where macam lack of father's figure masa kecil, So bila lepas tu kawan-kawan pun tak ada sangat. Lepas tu bila dia dah grow up, bila dah masuk dalam fasa adolescent, where they want to find a friends, where they want to develop their own identity, where they want to explore about the world kan, about dunia luar. So bila nak, tapi kawan-kawan tak ada ni. So that's where a signs of hallucination pula datang. A signs of hallucination where this person can see perempuan yang selalu ada dengan dia bila masa dia rasa lonely, bila dia rasa sedih. So maksudnya dia sihir sebabkan the trauma yang dia dapat masa kecil, tak ada kawan, father punya figure tak ada, so dia rasa lonely tau. Dia hanya ada mak dia, tapi mak dia pun jarang ada dengan dia. So maksudnya dia rasa lonely, dia rasa empty. So bila dia dah membesar, that's where dia rasa macam aku nak kawan. So that's where your mind akan create a figure untuk create a figure untuk jadi kawan untuk you. So itu so maksudnya kat sini a trauma also can lead to a psychosis symptom. Maksudnya macam contoh hallucination ke atau delusion ke and so forth lah. Lepas tu yang biasa kita dengar pasal PTSD kan Syahri? That's the common yang biasa kita dengar. Tapi not so PTSD ni dia punya symptoms sama juga macam yang kita cakap sebelum ni. Tapi the difference between PTSD dengan traumatic seseorang yang experience trauma yang biasa, PTSD is a disorder because of the traumatic events. Maksudnya selepas you experience trauma, okay, you akan experience this PTSD if it is not helped lah. Maksudnya your trauma tu tak being processed dengan baik, there is a potensi yang you akan develop PTSD. So PTSD, tapi like I said, PTSD is a disorder. So how it can be a disorder bila you punya trauma tu affect you punya functioning overall. Maksudnya you you punya functioning total terganggu lah. Macam tu. Syarif, I macam pernah bila cakap pasal PTSD ni kan, I teringat on one of my friends who pernah post on this issue dekat Palestine. So what do you think of orang dekat Palestine sana and in related to the PTSD?
Yes, correct, Ira. Yeah, we also do receive clients from Palestine.
Yes.
They experience a lot of trauma symptoms sebenarnya. And then untuk share dengan you kan, kalau lah you guys ada saudara mara ke yang stay dekat sana, ataupun orang-orang yang you kenal ada dekat sana, sebenarnya they are going through, sekarang ni kita panggil dia ongoing trauma lah. Apa yang dia lalui sekarang ni adalah ongoing trauma, yang mana dia all the functioning, it's impact dia punya emosi, dia impact macam mana dia punya cognitive, dia impact macam mana dia punya behavior, a lot of thing lah. Sekarang ni kalau lah you pernah berada kat sana pun sekali, dia boleh jadi trauma to you juga. Kalau you pernah experience the same kind of situations with what happens in Palestine, juga boleh jadi trauma to you. So dia panggil indirect trauma. So macam tadi orang lain kena marah, you been triggered, sama juga ini yang melalui benda tu you been triggered. It can be your trauma as well. So that and sebenarnya Ira, you know, trauma also can affect, macam you tanya I just now kan, I lupa nak jawab. Trauma can affect cognitive, our thought. Macam mana it affect our thought? One of it adalah dia mengganggu kita punya decision making skills, ataupun dia boleh jadi you indecisive towards something tau, bila you experience trauma. And then you susah untuk you membuat satu keputusan yang you rasa macam is tepat, disebabkan diganggu oleh the past experience or the treated properly lah. Macam tu.
Betul. So maksudnya trauma punya efek ni walaupun macam Syahri cakap tadi ada trauma yang berlaku dalam acute dalam masa yang singkat, tapi duration doesn't determine the severity of the does not solely bukan itu sahaja, the duration bukan sahaja yang menentukan the severity of the trauma itself. Tapi macam mana bila you experience trauma, so seberapa severenya simptom-simptom yang you rasa. Walaupun dia sekejap, tapi every time you rasa, sangat-sangat buat you rasa uncomfortable. And kalau dia dah sampai ada avoidance behavior while you are supposed untuk face it, kan? Tapi sebabkan you punya simptom tu buat you want to avoid, itu dah boleh macam mengganggu you punya life functioning as well.
Okay. Kena dekat sekolah, kena bully dekat sekolah juga part of trauma. Kalau you kena bully sebagai contoh, you kena sentiasa dihina, you ni hodoh lah, gini orang condemn you masa you dekat primary school. That's part of the trauma and develop complex trauma bila you dah besar. So that be aware of the symptoms. Kalau adanya avoidance behavior, it can be related to your past experience and it can be one of the symptoms of trauma that you are experiencing. Be aware of it.
Okay. Alright, okay. So now, berapa hari ni? Oh, kita ada 15 minit lagi Syahri. So
you apa yang you boleh buat, tapi we do have a limited time lah to share everything about trauma in just one single hour. Okay, but at least you know something lah about your trauma and you know something like basic things that you can do if you experience all the symptoms.
Betul. And kenapa kita kena emphasize juga macam the symptom and kenapa kita nak terangkan juga apa itu trauma, sebab before you help yourself or before you help other people, it's good if we could understand first what is trauma. Because the first step untuk menolong adalah awareness. Pre-awareness kena ada dulu. Barulah kita boleh menolong sama ada diri sendiri ataupun orang lain. Okay? Alright. So sekarang apa yang kita cakap tadi dah harap boleh membantu untuk increasekan sikit awareness tentang apa itu trauma. And satu lagi Syahri.
What we share just what we share just apa yang kita share dengan you ni sebenarnya it just 5% lah about the trauma. Sebenarnya trauma is very
yes, 5% about trauma sahaja. Tapi the thing is yang saya rasa paling penting untuk emphasize adalah bila kita cakap tadi how trauma can lead to a mental health issues kan, kita biasa juga kebiasaan juga untuk orang yang mengalami trauma ni, especially yang on a big event lah, kebiasaannya diorang akan involve in a substance use ataupun alkohol ataupun self-harm behavior untuk kurangkan rasa sakit yang diorang rasa, untuk buang segala memory yang ada. So maksudnya diorang akan involve in a unhealthy behavior lah. Macam drinking alcohol ke ataupun substance abuse kan. So itu pun boleh dikatakan kalau dia macam mana cakap, kalau dia punya cara you consume tu terlalu berlebih-lebih, dia boleh jatuh pada mental disorders as well.
Correct.
So that's how trauma can lead to a mental health issues lah. Okay. Syahri, let's go to the last part of our life today. So how to process the trauma?
Yes, correct. Okay. Trauma is very difficult to process. It's very difficult to process.
The ups and downs.
Yeah, that's the fact. So, difficult lah, susah lah untuk process as compared to things lah. Itu yang pertama. Yang kedua adalah to process the trauma. Okay, ni lah menjawab yang ni. What are some theoretical orientation or technique that are effective sometimes? Okay,
Dah kena pin dah question ni ha.
For theoretical orientation ataupun approach yang boleh digunakan untuk proses the trauma, seseorang untuk proses the trauma, if you want to become a therapist, you kena undergo certain training.
Yeah.
For example, one of the training that you need to undergo adalah certified clinical training professional. Clinical certified trauma training professional CCTP. Ni adalah training untuk trauma. Tu yang pertama. Yang kedua adalah advanced approach, which is we call it eye movement desensitization and reprocessing ataupun EMDR.
EMDR.
This is also one approach to process trauma lah. Tapi untuk orang awam, you tak perlu nak undergo this thing lah. Sebab ni
Yes, because it's a clinical training. So ini untuk menjawab yang itulah theoretical orientation lah. Mungkin this person mungkin nak jadi future therapist ataupun mungkin sekarang dia adalah therapist, we don't know. So kena undergo certain training lah. Tapi yang biasa kita dengar adalah EMDR kan. EMDR quite famous jugalah in treating the trauma. Tapi to say about the suitable approach to help a trauma client ataupun a trauma orang yang mengalami trauma ni, there is no specific approach. It depends on the individual. Maksudnya ada yang boleh terima EMDR, ada yang tak boleh. So kita kena ikut kesesuaian juga.
Betul. Based on the person.
So we hope we answer your questions on that part lah.
Betul. Tu yang pertama. And then yang kedua, apakah teknik yang boleh buat bila you experience all those bila you experience trauma symptoms? Yang pertama sekali adalah yang ni orang sentiasa boleh cakap tapi tak ramai orang boleh praktis. Jadi sebenarnya able to be relaxed. Yang ni bila you experience all the symptoms, yang pertama sekali, first step, walaupun you come therapy ke, you tak come therapy ke, you do not come to the therapy or you come to the therapy session, yang paling penting sekali adalah learn how to relax yourself when you experience all those symptoms. Yang ni first step. You come therapy pun sama, you tak come therapy pun sama, you kena belajar macam mana untuk you be relaxed when you experience all those symptoms. Sebab
betul.
Relax, other treatment, other techniques, whatever techniques that therapist,
apa pun tak jadi.
Apa pun tak jadi. Sebab first kalau you trauma, yang pertama sekali you boleh relax dulu. Sebab therapist tak akan continuous another approach, another method selagi mana you tak boleh relax. Selagi mana you aja relax when you the traumatic the trauma symptoms. So learn how to relax yourself.
To talk about learn to relax ni kan Syahri kan, I would say dia bukan terjadi dia pada trauma, it jadi pada mana-mana condition sekalipun lah. Macam contoh anxiety ke, you have to learn to relax first. So macam I cakap tadi lah, trauma, the reaction yang biasa kita nampak, the body reaction yang body try to hantar to us untuk bagi tahu yang kita ni dalam danger adalah contohnya macam fight and flight response. It's either you lari ataupun you being defensive, kan? So maksud apa yang saya rasa ni adalah kejap, relax kejap. Dia macam tu. Learn how to be relaxed first. Tapi on how to learn to relax first first of all you have to know dulu yang you have been triggered. So that's where learning on your body signal. Ni yang kita nak belajar ni, macam mana aku nak kenal diri aku. Belajar kenal macam mana kalau aku anxious, macam mana kalau aku marah, macam mana kalau aku tengah dalam keadaan trauma. Belajar kenal diri sendiri melalui your body signal. Ah, So tak so kenal pasti.
Yeah.
Tanda-tanda your body tengah hantar dekat you yang you sekarang tengah dalam keadaan danger. Ah, contohlah, macam contoh kalau okay you tengah berjalan lepas tu ada perompak lah belakang you. So macam mana
Mm.
your body tengah bagi tahu you yang you kena lari sebab ada perompak belakang you. Macam so you akan rasa certain signal kan yang your body trying to tell you. Kan? So
Yes.
baru you boleh angkat kaki untuk lari. So macam tu juga macam mana nak relax, first you kena tahu dulu body signal you.
Mm. Mm.
So it will be a technique of relax yourself lah, a relaxation techniques as well, which is identify your body signal first.
Yes.
Sebab orang lain cara dia our body try to tell us. So you jangan
Mm.
tengok kawan you punya body signal, you tengok you punya body signal.
Yeah.
Ah,
Yeah.
yes.
Yani
Macam
you
tu.
as I'm about to lose my voice. So
Okay. Alright,
uh,
Syahri. So,
jadi macam ni, you guys kena
uh,
cuba explore what can relax you when you experience that. Apa ni, what's the possible thing can makes you feel relaxed lah. Cuba
uh,
explore dulu apa. Cubalah any search lah dalam Google, cuba try satu-satu. Oh, kalau deep breathing ni, breathing macam ni, breathing help me relax or not? Try and error dulu, explore yourself dulu, tahu macam mana nak relax the symptoms. Yang tu dulu.
betul.
And Ira mungkin can help me explain further. Since my voice got to use my voice.
Okay.
Yeah.
Alright. Okay. So macam Syahri cakap tadi, I continue daripada apa yang Syahri cakap tadi. So maksudnya after you dah tahu what is your body signals that tells you are in danger, so maksudnya you dah rasa uncomfortable kan? So this is a time for you how to relax. Bila dah tahu signal dah ada, how to relax. That's where you boleh cari apa-apa sahaja aktiviti yang boleh buat you bagi relax. So explore. So kalau rasa tak boleh nak explore, then come to us. We help you to explore. Kita
Yeah.
explore sama-sama. Macam tu. So the key point here adalah exploring. Sebab you yourself lagi tahu macam mana your body punya reactions and apa yang you boleh buat untuk calm you down. Kalau I cakap buat deep breathing, mungkin tak sesuai untuk you. So mungkin cara lain yang boleh buat you calm. So explore you punya diri sendiri, apa yang your body signals as well as apa yang you boleh buat untuk calm yourself.
Yeah. Betul.
That's the first thing. Lagi yang satu lagi ya Syahri yang yang I suka emphasize adalah a mindfulness technique. Mindfulness technique lagilah dia sangat-sangat membantu kalau you dalam keadaan dissociate. Macam I cakap tadi kan, dissociate where you dah tak boleh nak differentiate. Am I reacting to a current world, to a present world, ataupun am I reacting this way because of my trauma? Maksudnya you're reacting to what happened in your past. Mindfulness technique help you to ground yourself back, to be present back, which is maksudnya mindfulness technique ni simply say dia macam nak bagi tahu, hey, what happened to you is in the past but your body is in the present. Okay, so mindfulness technique help you to differentiate lah, untuk bantu you ground yourself back, so you akan mind you pun akan sama together dengan your body dekat present. So, macam tu. So mindfulness technique and satu lagi yang saya rasa simple technique yang boleh try to practice adalah is a butterfly technique ya Syahri. It's a simple one. Butterfly technique, you can search online. Butterfly technique. Dia nampak macam simple je, like you hug yourself. This one is a butterfly hug, ataupun you macam ni, you pamper yourself. Sebab dalam keadaan trauma kita rasa tak safe. And not all people can give us a hug. Not all people can tepuk bahu kita, bagi tahu tak apa, kau selamat ni. Kau selamat dengan aku. Kan? Not all people, tak ada orang 24 hours boleh bagi kita macam tu. But we can do that to ourselves 24 hours. So that's why you boleh buat butterfly hug ataupun pamper yourself macam ni.
Yeah.
Okay, so this is one of the technique as well lah untuk kurangkan rasa unsafe tu.
You rasa kalau you rasa macam tak boleh sangat, dah cuba juga, you boleh cuba juga journaling. Cuba journal.
Yes, journal. Cuba journal.
Itu juga membantulah untuk you process trauma.
Ya,
Tapi
betul.
sebenarnya it's better kalau you process with the professional lah. It's better.
Betul.
Kita boleh ada direction, kita boleh ada flow dia lah untuk process you your trauma instead of main here and there kan. So maybe a bit difficult. You go to the professional yang boleh bantu you untuk you process the trauma itself lah. Macam tu. Tapi itu apa ni? The techniques may be helpful for you, but maybe it not works for some people. It works for people. Cuba aja kalau you tak boleh macam tadi, find to tapi relaxation tu is compulsory. Regardless. It's compulsory for you to explore what things that can help you relax yourself. Yang ni is compulsory lah kalau you nak kalau you nak trauma. Sebabnya advance punya approach tak boleh selagi mana you tak boleh nak relax macam tu. So yang tu memang compulsory you know how to relax yourself when you experience all those trauma symptoms. Is about mindfulness. We wanted to explain details sebenarnya about mindfulness ni, cumanya tapi masa kita ada very limited time to explain further. Tapi I hope that it can give you some brief information that I can practice mindfulness, so that you cuba search about the mindfulness lah in Google lah. You try to Google about and find more information. And the third thing is about journaling. You can search also about journaling, how to do journal when you experience trauma. This also might be a good approach for you to process your own trauma.
Ya. Dan satu lagi Syahri yang I would like to add adalah self-care. Ini sangat-sangat penting juga untuk you do your self-care. Maksudnya your routine, kalau boleh try to have a routine in your life lah. Tapi jangan terlalu rigid sangat pula. Kan bila kita cakap routine ni, certain people dia ambil benda tu sebagai rigid terus. Maksudnya inilah routine aku everyday, tak boleh nak tukar. Tu pun tak boleh juga. So maksudnya the reason we want to emphasize on the routine ni adalah supaya kalau boleh tak ada masa lapang yang boleh buatkan you having a flashback ke, atau boleh buat you teringat-ingat the memory. So maksudnya try to have a routine dalam you punya life, dan dalam masa yang sama cuba pamper diri sendiri dengan bagi kasih sayang yang cukup lah. Maksudnya buat aktiviti yang sihat, pergi berjogging, pergi exercise, dapat makan yang sihat, dapat makan yang secukupnya, macam tu lah. So self care lah maksudnya. Tahu, saya rasa semua faham apa maksud self care tu kan. Kalau nak cerita self care masing-masing ni, lain orang lain self care-nya. Yes. So so monitor on your self care lah. So I guess Syahri itu sahaja untuk hari ni. Dah pukul 1 dah pun. Yes, untuk hari ni.
Short untuk trauma, I know. Sangat sedikit lah masa tu untuk is pretty short lah untuk discuss.
Betul.
Tapi this life can help you macam dapatlah a brief understanding about the trauma, and then if you wanted to understand better about the trauma, you can come to us, so that we'll try our best to help you process your trauma, and you can that's better lah sebenarnya. Okay, I think that have a good day.
Yes.
Bye.
So next IG live kita will announce in in our IG lah. So keep follow us to know our latest update ya. Okay. Alright. day everyone. Bye bye.